David, we're just going to jump right in. I know your time is limited, so tell us a little bit about the flagship, the cornerstone of LifeWave, which is X39.
Yeah, so X39 came after 10 years of development work into stem cells and regenerative medicine. And basically, I was looking for a way to activate stem cells as opposed to having to inject stem cells in the body. So we engaged in research in both the United States and in Ireland. We were working at the Regenerative Medicine Institute at the National University of Ireland, and we were funded by Scientific Foundation Ireland for this work. And that resulted in over 70 patents globally on new methods for activating stem cells. So essentially what this means is that you don't have to inject stem cells into the body. We can use light therapy or pulsed electromagnetic field therapy to get the stem cells that are already endogenous, the stem cells that are in the body to act like younger and healthier cells. So that was, I think, some very exciting outcomes of this research work. And that, of course, ended up in the product that we call X39.
Absolutely amazing. No, I've actually had stem cell injections. Very pricey, very pricey. I think it was like $10,000 in my shoulders. Probably all my days of doing pull-ups in the SEAL teams kind of had its effect over time. It had, I think, a minimal effect. But I can tell for a fact that the X39 has been, I wish I'd known about it before, because X39 has definitely turned around a lot of aches and pains and so forth. My shoulders started to act up because normally when you get a stem cell injection, you have to keep getting them. And like I said, they're very pricey. So this is very cost effective. And how do you approach that from your point of view, the cost effectiveness of X39?
Yeah, well, actually, in order to address that, we should talk about the efficacy because you brought up an incredibly big point. With stem cell injections, they're not entirely effective, and it's a little bit of a double-edged sword. And one of the reasons is that stem cells was discovered in La Jolla, California, at Sanford Burnham, that stem cells are attracted to inflammatory cytokines. So you need this inflammation at the injury site because it's going to break down healthy tissue. But very often, the inflammation is chronic. So when the stem cells get to the injury site, the inflammation kills them off. What makes and that's why stem cell injections can have either very good or limited efficacy, depending on how that inflammation is managed. So the beauty of X39 is that it elevates a natural peptide in the body called GHKCU, or copper peptide. And this copper peptide, in addition to being known to mobilize stem cells, is also going to help to manage the inflammatory process. Very often, what people will do when using our products, they'll apply an Eon patch to the point of pain, so in your case, to the shoulder, and then X39 at the back of the neck. And this is a phenomenal combination because it will both help to manage the inflammation and mobilize the stem cells, along with a number of other very significant health benefits. So, in terms of cost effectiveness and safety, there's nothing with X39 that's going into the body. It's stimulating the skin with light. We have the clinical studies to show that it is elevating copper peptide. And all of that with X39 is about $100 a month compared to $5,000 a month for stem cell injections.
That's fantastic. And I know we've done a show in the past where that's interesting. You talk about the inflammation part. So we talked about the vaccination, COVID-19 vaccination, and how X39 had actually helped people that were having, like you're talking about, inflammatory problems, basically the cells, the blood cells clumping together so they don't transport oxygen as efficiently. And then, we saw that the X39 actually helped that tremendously. And is that because of the inflammation effect, or were there other factors that were involved?
Yeah, so we performed two studies on individuals that had had the mRNA vaccines. And what we found that was contradictory information at the time. In other words, the pharmaceutical companies were saying that you would get an injection of the mRNA vaccine and the inflammation was only temporary, that it would clear out in about 2 weeks. And we found that wasn't true. We found in 100% of the population that we studied, 80 out of 80 people, that even after 4 months, their inflammatory markers were still high. This was an incredible concern. We also found elevated white blood cell counts. So that means the immune system was responding as if there was an infection in the body. And of course, over time, this would lead to potentially lead to autoimmune disorders. So there are a number of natural solutions on the market. So for example, a very common one that was recommended at that time was N-acetylcysteine for the purpose of elevating glutathione to help manage the inflammation. And we found that X39, not surprisingly, had antioxidant-like activity and also elevated glutathione levels. So we did, in fact, find that use of X39 helped to manage inflammation.
Wow, incredible. And it definitely has. We do a weekly miracle show, and people have come in with incredible miracles they've experienced with LifeWave. Now we have RFK Jr. that's coming in, and he's talking MAHA, Make America Healthy Again. Now he's talking about how he's going to come in with because we kind of like had to go on the down low a little bit with the stem cell stuff. Unfortunately, he's coming out and saying that he's basically going to take the reins off of anything like that from big pharma, big food, big agri. What are your thoughts on that? Is that going to help LifeWave at all?
For full disclosure, I was invited to participate in RFK's panel in terms of what he's attempting to do. I declined because my duties at LifeWave keep me extremely busy, but it was certainly an honor to be recommended for that council. I'm a huge fan of what RFK is wanting to do in terms of revamping the FDA and especially getting them to stop their attack on nutritional supplements. It should be a free and open market. Nobody wants a company that is going to be making claims that will defraud consumers or present information that's false. Nobody wants that. So there's obviously a role there for the FDA. But there does need to be a little bit more freedom in the market. And companies absolutely need to be able to tell the truth about what these supplements are doing. The clinical research is all there. So I'm definitely a fan of what RFK is doing. Absolutely.
Wow, that is a great honor. I wish you could have been free to do that. That probably would have made a great impact, but I'm sure there'll probably be you guys will be in touch a little bit there. So hopefully.
Well, actually RFK is using our patches. And
okay.
And someone told me that he enjoys them. So
I bet he does.
we'll have to see where that goes.